To discuss this a bit more further, we're now joined by the head of health at AUDA NEPAD, Chimwemwe Chamdimba, and she joins us via our video link. Chimwemwe, thank you so much for joining us here on SABC News this evening. Perhaps let's start off with you just telling us more about this conference and what's the significance of it.
Thank you very much for having me today on SABC. Actually, the conference, as you've rightly said, it is reflecting on the progress that the continent has made in regulatory systems strengthening for medical products. And the way you've introduced the subject, the fact that in the last 2 years, we couldn't hold the conference physically. We had to do it virtually because of the COVID-19 pandemic. And what we faced during COVID-19 made even medicines regulation a very important or fundamental pillar of the health systems when it comes to ensuring access to medical products and technologies that are safe and efficacious for the people of Africa. You may recall that during COVID-19, our member states, the African Union member states, even if they had resources to be able to buy the medical products and technologies that they needed, they couldn't access them. The supply chains were disrupted, and unfortunately, we don't, manufacture as much as we need to ensure health security of the continent. And as a result, we depend on importation. And I think when you look at it currently, even on vaccines, we can only produce 1% of the vaccines that we need. It means it is dire. It is a dire situation. So medicines regulation ensure that we create an enabling environment for the pharmaceutical sector growth. And that, the challenges that we faced during COVID-19 made it urgent for Africa to really reflect on the health security of its people, in the sense that we needed to reflect on our capabilities to supply medical products that we need for our population. So this conference, actually the theme of this conference is looking at linking the progress that we have made, linking strengthening of regulatory systems to really ensure that it directs us towards improved local production of medical products, and it leads us towards ensuring that our people have access to a sustainable access to safe, quality and efficacious medical products.
And Chimwemwe, you speak a lot about COVID-19. Would you say that SCRUMA has taken more action after the COVID-19 outbreak? And would you say that looking at the pandemic and the role it played on the African continent, would you say that COVID-19 was an eye-opener for African health stakeholders?
It was indeed an eye-opener. I think we've been talking about health for the longest time. I would like to take us back a bit. I would like to take us back to 2001, when the continent was really also struggling with HIV/AIDS pandemic. And at that time, you may recall, our presidents, our heads of states from the African Union met in Abuja to reflect on the HIV/AIDS pandemic. And one of the critical things that was noted at that time was the fact that for us to be able to strengthen our health systems and for us to be able to better respond, we needed to ensure that we also invest in local production that will ensure sustainable access to medical products that were needed at that time to fight the HIV/AIDS pandemic. And that led us to 2005, when we adopted the Pharmaceutical Manufacturing Plan for Africa, meaning that we now needed to really push the drive for local manufacturing. But, this steps were made. Later on, we even developed a business plan, and we developed systems that we really wanted to manufacture our own medical products. But I think I wanted to take us back a bit because, yes, the continent knew. We knew that we have challenges. We knew that we needed to do certain things differently. However, the COVID-19 just brought back this issue with full force, because it was even worse. Remember when we closed our borders, when we closed the continent, and people were dying of the COVID-19 pandemic, and we didn't have access to what we needed. And I think it was a wake-up call. And I think our heads of state now started realizing that, it's not about resources. It's not about having money in the pocket. But if you have money in the pocket and and you are not able to buy what you need, then the money is useless. And that's why we needed to really have health security of our continent.
Yeah.
So I think, yes, COVID-19, as much as it had a negative impact on our people, it also has brought in a lot of rethinking of our health systems, rethinking of what we are putting our money on. Are we putting our money where it matters? And health is, I think, critical. It made us realize the impact of health on economics and the other way around.
And coming to health policy and medicine policy, why is the African medicine policy standardization so important for the continent?
It is quite important for the continent because, well, when you look at medicines, I think they're not just like any other product. They're not just like you go into a shop and buy a shoe just because it fits, you put it on, and then you go around wearing it. I mean, you're looking at a product that if you're not guaranteed of its safety, it can do more harm than doing good to your health. So we need to ensure that the medical products, whether produced on the continent or produced anywhere else in the world, are good, are safe, are of good quality, and they will treat what we want the medicines to treat. They're efficacious. Well, this is a highly regulated space. And if we are talking about, well, ensuring that we should have access, it's not just about access, it's access to quality products. But also the fact that I think we are talking about issues of access. It means these products have to be able to move from one country to the other. They have to be able to be traded across the continent. And I think no country can do it alone when it comes to the regulatory system strengthening, but also ensuring that standards are at par, and so that a product that is produced in South Africa can move seamlessly to Zimbabwe, can move seamlessly to another country in the world, Kenya, Nigeria, Rwanda, and be able to be marketed because everyone has confidence in that product that it will do what it is supposed to do. So harmonization actually of medical products from the AU's perspective, we noted that it is an important component of it, because for us to be able to trade in pharmaceuticals, we needed to have our systems and our standards harmonized. And no country can do it alone. I don't think one country has enough capacity to be able to guarantee the safety and quality of the products that are circulating in its economy.
And certainly, I mean, when it comes to medicines and the quality, it's always an area of concern. How will you ensure that, counterfeit and substandard products are a thing of the past on the continent, especially for the more vulnerable and poorer countries?
You are raising an important point of substandard and falsified medical products. You may recall that it's not very long ago that we had a situation in Gambia where cough syrups killed our children in the country. And you also may recall that soon after that, a number of countries reported the cough syrup. We had a WHO giving an alert for Cameroon and a number of other African countries where the substandard cough syrup was circulating, and the impact that it had, not just on the health and morbidity of the population, that the young people that had access to that cough syrup, it even caused death, meaning that the impact of it is quite huge on the population of the continent. And I think when we realize that, before I go to what we are doing as African Union to curb this challenge, let me also reflect on the fact that, remember, our borders are so porous. If you find a substandard and falsified medical product in one country, be assured that in no time you are going to find it in the next country and the next country and the other country. So within our regulatory program, what we are doing is that we are actually strengthening the network that was formed under the World Health Organization of focal points that are dealing with substandard and falsified medical products, so that they're able to seamlessly share information. We are supporting regional economic communities to be able to do cross-border surveillance of their markets, so that no substandard and falsified medical products can cross the borders and move from one country to the other. So we are really investing in developing systems and strategies that will enable member states not to just act alone, but to act collectively in dealing with the issue of substandard and falsified medical products.
Chimwemwe, thank you so much for your time. That is Chimwemwe Chamdimba. She is the head of health at the AUDA at NEPAD.